Respiratory illnesses are much more common in winter, and this video is going to give you information about bronchiolitis in order to enable you to manage your child at home, but also to be able to tell when you need to seek medical help. Bronchiolitis is a respiratory illness. It's often caused by a virus called respiratory syncytial virus, or RSV, but there are many other viruses that can lead to bronchiolitis. These viruses are spread by droplets when you cough or sneeze, and they can live for a while on hard surfaces such as door handles. Bronchioles are the small airways in the lungs, and in bronchiolitis these small airways get infected. The infected airways become swollen and full of mucus, and that makes it more difficult to breathe. Bronchiolitis usually affects babies and young children under the age of 2. They're more likely to get bronchiolitis because their airways are smaller and more easily blocked. Most children will get better on their own at home. However, when feeding or breathing becomes more difficult, some children might need treatment in hospital. There are some babies who can become more unwell with bronchiolitis than normal, such as a baby born prematurely, very young babies, babies with heart or lung problems, and babies who have problems with their immune system. Bronchiolitis usually starts with a runny nose, a cough, and the cough can become worse over a few days, and sometimes a fever. Your baby may show signs of breathing difficulties. They may breathe faster than normal, and you may be able to hear a wheeze. They may need to make more effort to breathe, and in young children this can be seen in a number of ways, including nasal flaring. You might also see your child sucking in underneath or between their ribs. Sometimes when bronchiolitis is more severe, it might cause brief pauses in their breathing, or they can make a grunting sound. Your baby may feed less than usual, or vomit, or they may want to feed more frequently but take smaller amounts at each feed. This may lead to a reduced number of wet nappies. To summarise, most children will only have a mild illness with a runny nose, a cough or a fever. Some children can experience breathing difficulties such as wheezing, making more effort to breathe and problems with feeding. The symptoms of bronchiolitis tend to get worse over the first 3 to 5 days, and then most children will be better within about 2 weeks. The cough can last for up to 6 weeks or so, which is quite a lot longer than common coughs and colds. We can use a kind of traffic light system to indicate the various severities of bronchiolitis. What we call the green stage is when your baby can be treated at home. Your baby may have a cough and runny nose. They may have a temperature more than 37.5 degrees, but less than 39 degrees. They're taking at least half their normal feeds and having wet nappies regularly, and there are no more concerning features. Those will be amber or red signs. The most important thing is to make sure that your child stays hydrated. So if your child isn't feeding as well as they usually are, try offering more frequent but smaller feeds. If your child is breastfed, just continue to feed on demand. If your child is at least 6 months old and is unsettled with a fever, you can give them paracetamol or ibuprofen at home as needed. Saline, or salt water drops, can be helpful to clear their nose before feeds. Put the dropper just past the opening of your baby's nose. Squeeze 2 to 3 drops of saline in one nostril and then the other. Keep your baby in the same position for 5 minutes. Help your baby sit up if they start to cough or gag. Then, when they are settled, recline them back again to allow the saline to work. If your child is taking any medications or inhalers, you should continue to use these. Make sure that your child is never exposed to tobacco smoke. Passive smoking can seriously damage the health of young children, and it can make breathing problems such as bronchiolitis worse. Your child's own immune system will fight off the virus. Antibiotics are not effective at managing bronchiolitis as they only fight off bacteria, not viruses. If you feel you need more advice, you can contact your local pharmacy, health visitor or GP surgery. We might say that things go to amber if you're worried that your baby's more unwell. They might be taking less than half their feeds, they may be vomiting after their feeds, or they may be having difficulties with their breathing. If your child has any one of these features, if they appear to be getting worse, or if you yourself are worried about them, if they've passed urine less than twice in a 12-hour period, if your child's temperature is above 39 degrees, you need to seek medical advice that same day, either by contacting your GP surgery or if it's closed, by calling the NHS 111. If your baby needs to be seen by a doctor, they'll be looking at the baby's breathing effort and also how well hydrated they are, and they'll measure the oxygen levels in the baby's blood. What we'll call the red stage is if your baby's condition becomes more serious. If your baby is very sleepy, looks blue, if your child has blue lips or is struggling to breathe, has irregular breathing or has unusually long pauses in their breathing, or is unresponsive or very irritable. If your child shows any of these signs, you need to call 999. Your child needs to be assessed urgently, so call 999 and you'll be assessed in the emergency department. Having a child with bronchiolitis can be difficult and scary. However, it's important to remember that this is usually a mild and self-limiting illness, and children go on to make a full recovery. We hope that you found this video useful and that it's given you some confidence to know what to look for and when to seek medical advice when you're managing your baby with bronchiolitis.